Hello, I'm Kerry Straine. I want to thank you for spending a few minutes with me as we review the 5 success strategies that I believe every practice owner should be considering as they operate their dental practice on a daily basis. The one that allows them to fulfill the dream that they have for their career and support the mission and accomplish the vision that they've established for their future. As we look at these 5 success strategies, know that many of them you're working on simultaneously, certainly the first 4. And as you continue to develop strategies to lead your team to accomplish your dream, please keep these in mind. The first one is achieving the targeted patient base that you have for your practice. As a general dental practice owner, you're looking for consistent, continuing, raving fans, and that group of people is housed within your hygiene department schedule. The continuing care component of your practice is critical for housing the committed patients who believe in the treatment plans that you've given them. The treatment plans that you know puts them on a path of wellness. And in building that intimate relationship, the commitment that they make back to you and your team is the one that you're looking for. The strength of the commitment that has them reappoint, keep their appointment, pay their bill, and accept your treatment plan. But only that the committed few, the 1,200 to 1,400 of them that we want per dentist, those are the ones that we can count on to accept your treatment plan again and again and again as you develop a lifetime of a committed relationship with them. So as you look forward to the next 6 months, the next 12 months, I recommend you pick a target, a date, a time specific, where you and your team will focus on having X number of patients scheduled in continuing care that represent the profile of the type of quality patient that you want for your practice. You can do this together, one patient at a time, build the dedicated patient base that you're looking for. The second step in our success strategies is to deliver on the type of treatment planning philosophy that you believe in. We want to fulfill your commitment to offering the highest standard of care that represents the type of dentistry and hygiene services you have to offer. As we forecast out on the type of dentistry that you want to do, from restorative to cosmetic to comprehensive, we not only want to help you recognize that you can accomplish this, but realize it as we look back over the historical performance of your practice. Similarly, we want to look at your hygiene department. And if you've got a non-surgical perio program that you've decided to implement into your practice, and you believe that 20% of your patients should be in your perio program, we want to make sure as we look forward and back that we have the patients scheduled in the right procedures, whether it's an adult prophy or a periotherapy and perio maintenance procedure. You want to make sure that the patients who need those services are receiving them and moving on to a path of wellness. The third step in the success strategies is the elimination of unqualified patients. People whose response to the message that you provide them with is obvious that it doesn't resonate with what your philosophy is. They're not willing to accept treatment. They're not willing to reappoint. Maybe they're not willing to keep their appointment. You and your team have given it your best. You've looked in the mirror and asked yourself the question, how can we improve? And every day you're alert to the opportunities to help people every day by making sure your huddle checklist has you identify challenges in the schedule and opportunities to solve them, so you can connect with people and hopefully influence them to become the great patient that you're trying to develop. Keep in mind, not every patient's born looking to make a permanent commitment to you and your hygienist. I mean, in many cases, they're looking at you as a one-stop, one-time only, never have to see you again practice relationship. Thank goodness I have insurance. But in reality, you're trying to move them into a deeper relationship so you can be the person who keeps your eyes on their health. That is a dynamic role. And if you're committed to it and you are working towards leading your team to help you deliver on that mission, you'll accomplish attracting a better and better patient customer at any given time. As we work on the fourth success strategy step, we're always working on increasing your collection rate. So as step 1 says, we achieve our targeted patient base. Step 2, we deliver on our treatment planning philosophy. Step 3 says we eliminate the unqualified patient. Step 4 says over time we're always working at increasing our collection rate through, number 1, application of a sound financial policy. Making sure that, well, you're not a bank. We're not here to finance co-payments. In many cases, practices will participate by taking assignment of benefit, either at the fee schedule or when you have enough patients in your hygiene department that you can afford not to participate and be enrolled with an insurance plan. You can then take the assignment, in many cases, but not the fee schedule associated with that insurance company. You have leverage because of the goodwill you've created between you and your patient, and the fact that the demand for appointments is greater than your supply. When that happens, you can move on to the next level of increased reimbursement rates. And then, of course, the next step in increasing your collection rate is a fee schedule analysis. And make sure you're meeting with your field sales consultant to review where your fees are relative to the market so you're earning what you deserve. And the fifth success strategy is the ability to franchise your business template. And by that I mean, when you get to the point where you can't keep up with the number of new patient exams or the number of periodic oral evaluations or the amount of dentistry that's in your schedule, it's time to bring on another dentist. And when you have reached that point and you get to become a mentor and a coach for another professional, not only does it allow you to continue to experience the joys of ownership by growing leaders around you, but the quality of life experience for every dental practice owner who has a committed associate who could be a candidate for co-ownership to become an owner with you down the road. All those are wonderful things, but keep in mind, your business supports your life. It's not something that drives your life. And when we have someone else to carry on the mission in your absence, it frees you up to have your business truly support your life. So you're working the number of hours annually that you want to give to your business, and then giving back to yourself and your family and those around you beyond the business. And only then, when you've realized the benefits of focusing on the 5 success strategies, will you truly be in control of your practice. I wish you the very best and look forward to talking with you soon.